Muralidhar Sharma sir, Professor Emeritus, STMCA Udupi, to take over the session. Welcome to you, sir.
The next is about Jvarapratishedha Vyakhyasyaamahe Thvati Budandanandarihi. The protocol of the treatment of Jvara. Yena amritam apam madhyad udhritam purujanmani yato amartvam sampraptaha tridashaha tridiveshwarat शिष्याः तं देवमासीनां पप्रच्छुश्रुतादयः वृणस्य उपद्रवा प्रोक्ता वृणनामप्यतः परं समासः व्यासतश्चैव ब्रूहिणो भिषजाम्बर. Now, the chapter on the Jvara Chikitsa starts with the initial introduction of the students to the teacher, where they request the teacher to teach about the complications of Vrana. Now, here again, we will have to consider the importance of the word Vrana in Sushruta. Vrana doesn't mean only the wound. Now, in general, it relates to the wound, but it's beyond that. Any of the disease which becomes more complicated, which reaches the Bhedavastha, is also called as the Vranitavastha or Vranavastha. And hence, any of those diseases which become so complicated, and they present with their complications, the different types of the complications which can occur, and such diseases are to be discussed in the present chapter, and the students request the teacher to teach about that. And the description of the teacher is like he is the reincarnation of Dhanvantari, who had really collected that nectar, amrita, from the sea, as that's about the story. Now, Upadravena Dustasya Vrana Krithena Siddhati, Upadravastu Vranayaha Krithasatyaha Prakirtilaha, Prakshena Balamamsasya Shesha Dhatu Parikshayata, Tasmad Upadravan Kristan Bruhina Sachikitsadana, Sarvakaya Chikitsa Suyodustaha Paramashina. Now, the students request the same again, all the complications of the Vrana, and which can become aggravated in a patient who has already impaired immunity, impaired physical condition. And all such complications which also are the subjects of Kaya Chikitsa, they are to be taught to the students. That's what the students would be requesting. Tesham tadvajanam shrutva praprabhit bhishambaraha jvaramadav prokshami sa roga anikarat smritaha rudrakopagni sambhutaha sarvabhuta pradapanaha teihi steihi namabhi anyasham sattvanam parikirtire. Now, the teacher starts with the introduction, like it would be the Jvara would be the first topic to be discussed, because Jvara is considered to be the king of all diseases. The origin of Jvara is related to the anger of Ishvara, and it affects all the living beings in the world, and they could be named with the different names based upon the type of the species of animal which is involved, as well as it could also be named with the different presentations as such. Now, Janmadav Nidhane Chaiva Prayo Vishatilehinam Radha Sarva Vikaranam Aya Raja Prakirtilaha. The Jvara or the increased temperature condition can occur even at the time of the birth and at the time of the death even, and throughout the life it is one of the most common presentation of a disease, and hence it is considered as Rogani Karata, which is considered as the king of the diseases. Now, from the contemporary medical point of view, fever is not considered as a single disease. Fever is considered to be a syndrome which could be produced due to multiple complications. And if you write a diagnosis of simply fever, from the contemporary point of view, it's not an acceptable diagnosis from the contemporary science point of view. But there is a hit in the whole theory. So you have to specify, you are supposed to specify the cause of the fever, and then like it's produced due to such and such infection or so on, and then only it will be a valid diagnosis. But again, the hit is there is a one absolute accepted diagnostic condition which is mentioned as a pyrexia of unknown origin. A fever of unknown origin is a valid diagnosis, but a simple diagnosis of fever is not a valid diagnosis. That's a very controversial issue. So, if you write a diagnosis of fever from the contemporary science point of view, it's considered as invalid. But if you write that there is a fever which is the cause of which is not known, a pyrexia of unknown origin, is considered as a valid diagnosis. So it's like showing the ignorance at that limit. And from Ayurvedic point of view, Jvara Lakshana, which is seen in many diseases, and Jvara Vyadhi, this also is quite issue of differentiation. When there are complications of other diseases which are produced with the hyperthermia or temperature raised, then they are the Jvara Lakshanas. And in plenty of diseases, Atisara, even Gulma, any of those conditions, Jvara can be a Lakshana. But there, the Jvara is a symptom of the disease, whereas the Ayurvedic, all the Samhitas, Charaka, Sushruta, but all the Samhitas would accept Jvara as a disease when the predominant symptom is the raise in the temperature and the other symptoms follow, then it is considered to be Jvara Vyadhi. Now, another issue of controversy in Sushruta is Rite Deva Manushebhya Nanyo Vishahate Tutam Karmana Labhate Tasma Devatvam Manushalapi Punashchaivatyutah Sargat Manushyam Anuvartate Tasmatte Deva Bhavena Sahante Manushadjuram Sheshaha Sarve Vivadhyante Taryak Jvanaha Jvarapratishedha. Now, this is one of the controversial issues. Sushruta, according to Sushruta, the Jvara is a disease which can occur only in the celestial bodies, Devatas, as well as Manushas. In Devatas, that's the celestial bodies, like which we generally translate as gods. Now again, controversial, like whether Devata has to be considered as a god or celestial bodies. Celestial bodies in the sense, as per maybe our notion, the living beings which are beyond this earthen universe, whether such a living being is there or not, all the controversy, will not go into that part. And according to our epics, Indian epics, the Devatas, like Indra and their followers, they also can develop fever, but in them the fever is an absolutely self-limiting disorder and it doesn't require a treatment. Whereas Manushas, because as per the epic, the Devatas from the Swarga, when they come down to the earth, they become Manushas, the human beings, and hence the human beings may develop the fever which may require treatment. Whereas according to Sushruta, Tairyak Jonaha, the species of animals which are lesser than that of the human beings, that less evolved animals, if they develop fever, they will die, and there is no question of a cure in such conditions. They invariably they die. But this fact is not absolutely correct. We know that the fever can occur in any other animals, even vertebrate animals. They would have the fever exactly in the same manner as that of the human beings, and that either it can be self-limiting or it can be treated. Not necessary that it is leading to death. Even in the cold-blooded animals, that's now it's well known. Very recent studies have shown that cold-blooded animals also develop fever-like symptoms when they are sick, and they cannot generate fever by themselves. I have copied this sentence from the reference, and though they do not develop the fever by themselves, they seek an additional heat to raise the body temperature, and this process is called as behavioral fever. Now this is a very recently coined word. So Teriac Joni, even in the lower animals which are cold-blooded, the fever-like condition develops, and either it can be self-limiting, where the animals they go for that cure by themselves by reaching to a spot where the temperature can be raised. So there is a need to raise the body temperature to fight the disease. That's all the basic issue. The description of or definition of fever or jvara is Svedavarodha, Santapaha, Sarvanga Grahanam Tata, Vikaraha Yugapadyasmin, Jvarasya Pariketitaha. The jvara is defined as a combination of three or triads of the symptoms, where there is a reduction of the sweating. The sweating has become blocked, the reaction of the sweating has blocked, and Santapaha, where there would be raise in the temperature, and Sarvanga Grahanam, a systemic involvement, where every system in the body is involved simultaneously, then it is called as jvara. Now, this is a very important issue. to define as a Jvara Vyadhi, a disease which presents with these three predominant symptoms like absence of the sweating, pain throughout the body, and raised temperature, then it is called as a Jvara. When simply the temperature is raised after certain other diseases have occurred as a complication of other diseases, then it becomes a Jvara Lakshana. So simply temperature, raise in the temperature is not Jvara. Whereas when we say fever now, fever relates to only the raise in the temperature. Other symptoms are not considered as an essential part of the definition of fever, and hence that fine difference has to be kept in mind, and hence we will not translate Jvara as fever all the times, though fever is the predominant lakshana of the Jvara. Doshaha prakupitaha sweshu kaleshu swaihi prakopanihi vyapya deham asheshena jaram apadayantihi dustaha swahetubid doshaha प्राप्य आमाशयम ऊष्मणा सहिताः रसमागत्य रसस्वेद प्रवाहिणां स्रोतसां मार्गमावर्त्य मन्दीकृत्य हुताशनं निरस्य बहिरूष्माणां पक्तिस्थानाच्च केवलं शरीरं समभिव्याप्य स्वकालेषु ज्वरागमं जनयन्ति अथ वृद्धिं च वा स्ववर्णं च त्वगादिषु. Now the vitiated doshas. Now vitiated doshas are the reaction of the body to the injury. When there is an injury, the doshas become vitiated, and as a result of that vitiated doshas, as a result of the injury to the body tissues, any of the tissues, organs of the body, it results in the Jvara. Particularly doshas which are vitiated and released at the site of the injury, they spread throughout the body, and hence they produce the Jvara. This is what the Samprapti of Jvara is mentioned in Ayurvedic literature. And the doshas, the vitiated doshas, also affect the function of the digestion function at the amashaya, and the rasadhatu, the synthesis of the nutrient food, would be affected, and this also results in Agnimandya. Digestive capacity is lesser, and this also results in the segregation of the heat or the Ushma into throughout the body, and hence the Jvara would occur. So that's the basic pathology of the Jvara according to Ayurvedic literature. From the contemporary science point of view, physiology point of view, the body temperature, the sources of the body temperature, heat in the body is produced mainly with the basal metabolic rate, the BMR, or the metabolism of the tissues. See, every tissue would be depending upon a metabolism to have the energy. The commonest form of the metabolism is the glucose metabolism, where the glucose is converted into carbon dioxide and water, and this is a exogenic reaction. There will be heat energy produced, and that energy is presented in the form of the heat. So major source of the heat generation in a living body is the metabolic activity. It's not only the glucose metabolism. Every metabolism would be resulting in various degrees of the energy released, and energy released can be presented in the form of heat. And then the other sources of the heat in the body are dynamic action of the food, like certain characters of the food may increase the temperature, like sour toast or sour taste, or the pungent taste, the katurasa, these amla rasa. These tend to produce a slightly increase in the temperature. The digestive activity would be increased, and that also can increase the body temperature slightly or add to the body temperature. Activity of the skeletal muscles is the other source. Shivering and exercise, like when you do the exercise, as the muscles are contracting, that increases the energy release of the muscles, and the formation of the energy in the muscles also would be increased, and hence there would be addition of the heat to the body. Then chemical thermogenesis also is occurring, one of the sources, mainly the thyroxine and the adrenergic hormones like epinephrine or norepinephrine. They help in increasing the body temperature by two ways. See, epinephrine and norepinephrine would be increasing the circulation, dynamic circulation, the rate of circulation of the blood would be enhanced, and when the circulation becomes hyperdynamic, the heat will be disseminated throughout the body faster, and that increases the temperature of the body, core temperature of the body. At the same time, epinephrine, norepinephrine also would be either regulating, either facilitating the constriction or dilatation of the specific blood vessels, and hence at the selective areas the blood flow can be increased or reduced, which also can raise or reduce the temperature at the specific areas of the body. Thyroxine or thyroid hormone is another of the hormone which directly affects the basal metabolic rate throughout the body. Every tissue would be having a mechanism of production of the energy. Thyroxine enhances that rate of production of the energy. It also increases the oxygen consumption. The basal metabolic rate is defined as the amount of the oxygen consumed by a unit amount of the tissue at unit time, and more the oxygen is consumed, the more heat is generated. It's something like more the heat, oxygen is generated, more substance is burnt, and hence there will be more heat generated. And thyroxine is one of that hormone which facilitates this activity, which enhances the activity, and hence the heat is produced by the thyroxine activity. Then there is another mechanism called brown fat mechanism. The brown fat mechanism is present in increased comparatively more in infants than in the adults, and is one of the major source of considerable heat production. The functions of this brown fat production is now well defined, and these certain of the recent investigations have proved that the major source of the heat is from the brown fat mechanism, where there will be changes in the structure of the proteins. The proteins will be converted from one new method or one older molecule to the newer molecule by activity in the cell medium as such, and it results in production of different sorts of the substances, like either it could be due to in the brown adipose tissue. The adipose, earlier adipose tissue was considered to be a metabolically inactive tissue, but now it's proved that there is a significant metabolic activity. Majority of the transamination reactions occur within the tissue as such, in the brown adipose tissue as such, and this produces a huge amount of the energy generated or heat energy generated, and this is under the regulation of the neurological control as well as the sympathetic control, and the heat production is one of the major sources of the production of the heat. Earlier it was believed that the adipose tissue would be just acting as a bad conductor of the heat, and hence it protects the core temperature. But now it is known that it is not only that conduction. Of course, that effect of the resistance to the heat loss is, of course, is true, but at the same time adipose tissue also is metabolically active, and that metabolic activity is one of the major source of the this heat as such, and the source is more in pigmented races than in the white or albinos. In the albinos, the amount of the heat generated is comparatively lesser, and the metabolic activity of the fat tissue also is comparatively lesser, whereas in the brown and dark, the metabolic activity is more. Now that's about how the heat is generated in the body. The heat lost from the body is by radiation, that's direct exposure. When the external temperature is lesser than that of the body, the heat is radiated. The heat may be conducted, like when you use a cold substance, apply some cold substance over the body, that due to the conduction the heat may be lost. By convection, by applying certain substances which can reduce the temperature directly, like applying ice over or spirit over the area. Then evaporation of sweating, perspiration and evaporation, the water vapors which are secreted out either during the sweating or simply the water, some amount of the water vapor continuously could be evaporated from the surface of the body. That's what we call as the invisible sweating. And respiration, through the respiration also, the air which is taken in would be colder than the air which is breathed out, and hence breathing also would be a means of heat loss from the body, as well as some amount of the heat would be lost along with the urine and the feces. These are the mechanism of the heat loss in the body. Now, thermoregulatory mechanism in the body is a very complex mechanism. which keeps the body temperature at the normal range, safe ranges. And this mechanism is a complicated mechanism which involves the mainly the central structures. Pituitary and hypothalamus is the major structure which involves the thermoregulatory. The thermoregulatory centers are presented at the hypothalamus area, and they are sensitive to the receptors from either the skin as well as from the core part of the body, as well as the thermoreceptors also are present at the base of the brain near the thalamus. Now all these input would be reaching to the hypothalamus area, and that results in the setting the point of temperature, body temperature. And once that body temperature is set, the peripheral organs like vasomotor response, that's the flow of the blood into the periphery, as well as the metabolic rate, sweating or shivering would be generated, would be activated under the control of the hypothalamus, and by these activities either the body temperature is raised or maintained at an optimum level. It doesn't cross beyond that optimum range of the temperature, which we call as the normal temperature. Normal temperature is considered to be in between 98 to 98.6 degree Fahrenheit, or 98.4 is considered as the ideal standard. And what happens is, suppose there is a heat loss, more heat is generated by reducing the sweating, blood flow to the sweating gland is reduces the blood flow to the skin, so that the convection heat loss is reduced. Even there could be shivering when the muscle activity enhances the metabolic heat generated. The digestive capacity, metabolic activity also would be enhanced, BMR would be enhanced, so that the temperature would be increased. Whereas if the heat is more in a febrile condition, when the body temperature is raised, the metabolic activity will be reduced, sweating response is enhanced, so that there will be more sweating, and the muscle activity will be lesser, so that the person would take rest, so that the heat generated will be within control, and that's how the temperature is managed. And mainly the hypothalamus is a major source whenever it comes to the thermoreceptor and thermoregulatory centers. The role of hypothalamus is the most important one, and it acts as a thermostat and initiates the nerve impulses from cutaneous thermoreceptors, and thermoreceptors are sensitive for both cold and heat, and hypothalamus also has the thermoreceptors called central thermoreceptors. And through these different mechanisms, the same thing which I have told earlier, through the as per the input from the different areas, it acts through the either somatic or sensory sympathetic nervous system. Somatic nervous system, because you feel either cold or hot, either you may cover your body with a warm cloth or move to a warm area, or you may expose to the cold or opt for certain environment which reduces the heat, so on, by active involvement, like you may sit on a fan or air conditioner or so on. Or it's the other way, by the sympathetic nervous system, by cholinergic activity where the sweat glands would be regulated, adrenergic activity where the blood vessels would be adjusted to separate organs, as well as shivering responses also are controlled by the issues. Now that's how the body temperature is raised. Now human fetus, particularly child, particularly fetus when it is in the uterus, in the intrauterine life, the heat production by the fetus body is almost twice that of the adult body compared to the body weight, and this is due to the basic issue of the increased metabolic activity in a new child, in a fetus. The metabolic activity, the tissue activity would be faster, more. But heat dissipation is not a problem as long as the placenta is intact. Placenta acts as a very effective heat exchanger, and even if the heat produced in the fetus is more, it will not be raised as the body temperature would not be raised. But once the child delivers, there is an important issue. The issue is the child tends to have a conflict or trouble with the adjustment to the environment, because now the heat exchange mechanism has to follow that of the adults, like the breathing, the surface area, and because the breathing is comparatively less effective in a newborn and immediately after the birth, there is a tendency that the heat may raise, the temperature of a child may be raised, and because they have a comparatively higher body mass ratio to the surface area of the body. Surface area is comparatively lesser. Like adults have a body mass ratio, body mass to surface area ratio of 0.01 square bound as such. That's 1.73 square meter area or 0.01 square meter of the body mass surface ratio. Whereas in newborn, the ratio is just around 0.05. Almost half of the 0.05 is in the children, and hence the heat loss would be erratic. Either there will be rapid heat loss or there would be a tendency to conserve the heat, and hence newborn, they tend to have comparatively higher body temperature, and though it's not considered as fever. Now when Sushruta says Janmadav, at the time of the birth that fever is there, it's not really a disease of fever, but the temperature will be comparatively raised. That's about the normal mechanism of the heat maintenance in the body, both in adults as well as a newborn. Then मिथ्यातियुक्तैः अपि च स्नेहाद्यैः कर्मभिर्नृणां विविधात् अभिघातात् च रोगोत्थानात् प्रपाकतः श्रमात् क्षयात् अजीर्णात् विषात् सात्म्यऋतुपर्ययात् ओषधि पुष्पगन्धात् च शोकात् नक्षत्रपीडया अभिचार अभिशापाभ्यां मनोभूत अभिशङ्कया स्त्रीणाम् अपप्रजातानां प्रजातानां तथा अहितैः संज्ञावतरणे चैव ज्वरो दोषैः प्रवर्तते. The different factors which can produce a change in the body temperature or causes which can produce the jvara would be either the mithya yoga of the different therapeutic regimen, which we call as iatrogenic. During the treatment protocol, if the treatment protocol is not followed properly, the snehadikrama, panchakarma, all sorts of that, such can produce. So iatrogenic is considered as the number one by Sushruta. It's important. Even now, among the diseases, iatrogenic diseases are the number one conditions which are produced by the physician due to the treatment error in the treatment, misjudgment in treatment. The diseases are produced, and Sushruta considers that as the number one cause for the jvara. Then abhigatacha, injuries of different sorts, any other diseases which can result in the jvara, or any of the diseases which go into a lysis. Kripaka is a lysis of the disease, can result in the jvara. Shramat, if there is a very rigorous exercise, the temperature could be raised. Kshayat, if there is a rapid metabolic activity and the tissue loss occurs or tissue degradation occurs. Ajirnacha, if the digestive capacity is not proper, digestive functions are not proper. Toxins, vishad, toxins which can produce the jvara. Satmi viparyaya, the allergic manifestations can produce the jvara. Rutu viparyaya, due to seasonal factors, the jvara could occur. Then Oshri Pushpagandhacha, smell and other factors of environment, again sort of the allergic phenomena. Shoka, psychological factors. Nakshatra Pidaya, celestial bodies, like it's something where factors are not known, which is related to the universal environmental factors. Then Abhichara Abhishapabhya, due to abnormal behavior, or if you are cursed by somebody else. Then Manobhuta Abhishankaya, again Shoka and Manobhuta Abhishankaya, they are the psychological origin. Shoka when there is a real sorrow, and the Manobhuta Abhishankaya is when there is a distress. Or Strinam Api Prajatanam, complications of the puerperium, or Prajatanam Ahitehi, after the delivery, if the normal parameter, these protocols are not followed, or during the generation of the milk also, the jvara could occur. Now, as per the current knowledge, the temperature regulation, we have discussed about the physiology of the temperature regulation, but that temperature regulation is intentionally modified by the patient, by the body, human body, as a response to the injury to the tissues. And the fever is a sign of an infection or inflammation, which is an immune response of the body. Now, we have discussed about the inflammation earlier in some other context. Inflammation is a a reaction of a tissue due to injury, which could be at different levels, and primary aim of that inflammation would be, the first of the thing is to minimize the area of the inflammation injury, so that injury is not affecting the whole body. Then the next part is they salvage the tissues. Those tissues which can survive, they have to be protected. Those tissues which cannot survive, which are not viable, they have to be removed along with the source of the inflammation, and then the repair. So these are the major three steps in the inflammation. Now suppose that local reactions, localization is not possible due to many factors, either due to the intensity of the inflammation, and as we have discussed earlier, whenever there is an injury to the tissue amines will be released, and tissue amines will be generating the inflammation. Now, if the amount of the tissue amines produced is comparatively smaller, the inflammation will be limited to that area, localization, and there you may have that swelling, and maybe at the end it may end up in a suppurative ending or fibrosis or proper healing, primary healing, and so on. But suppose if this is not capable of doing controlling at that area, there is a need for a focused response by the body, then these cytokines would be producing a reaction which you call as a febrile reaction, and that febrile reaction is actually to protect the body, to enhance the capacity of the body to fight with the disease, and ultimately result in a repair of the injuries. And these responses are categorized as a pyrogenic response, where the pyrogens, that's the pyrogens are, I'll come to that list of the pyrogens next, I'll discuss about that. These are the chemical substances which are released from the injured tissues or affected tissues, and it affects the hypothalamus and it tends to raise the body temperature. Purpose of raising the body temperature is, at a higher temperature, the amount of the energy produced will be more, and that higher energy would be capable of protecting or maybe having a better capacity to fight with the disease. So amount of the energy in the body has to be produced, and energy utilization has to be reduced, so that there will be more focused activity over the fight activity, so that there will be disease would be controlled. Now, to enhance the temperature, the responses could be, the first of the thing is the cytokines, they would affect the body thalamus, and the thalamus would having a higher thermocouple center or temperature level would be raised at a higher level. To keep up that, to cope up with that raised level of the temperature set by the thalamus, the body metabolic rate enhances. The first of the thing would be to enhance the metabolic rate. The blood flow to the cells would be, particularly muscle, would be faster. So heart rate increases and the circulation becomes dynamic. And when the muscles will have a more activity, the amount of the temperature is increased. But if that's not enough, then the muscles will be made to contract involuntarily by again neurogenic activity, central nervous system is an involuntary contraction, which is called as shivering. Shivering would produce more heat, muscles will be contracting more, and hence the shivering is one of the common clinical symptoms seen in a case of febrile condition. Then, to preserve the heat, so the first is the generation of the heat is enhanced. To preserve the heat, the blood vessels to the skin will be constricted. So vasoconstriction would occur. So vasoconstriction would help in two ways. When the blood flow to the skin is lesser, the amount of the heat lost by convection or conduction would be lesser. At the same time, when the blood flow to the skin is reduced, the sweat glands also become less active. So amount of the sweat in the form of visible or invisible perspiration also would be lesser. Swetavarodha as the predominant sign of the clinical symptoms. And the pain throughout the body could be pain, and impaired muscle activity would be presented Dandabhanga, which is the other sign, like which is produced due to the muscular stimulation or shivering and so on. The decreased heat loss is done by specifically inhibiting sweating. the sweating is inhibited by reduced blood flow to the skin, as well as the sweat glands are under the control of parasympathetic stimulation, and that also will be helping in reduction of the sweating. Heart rate and respiratory rate also would be increased so that the amount of the oxygen available to the tissue will be faster. So to meet with that increased metabolic activity, the rate of respiration would be faster. Then metabolic changes also would occur, which would be mainly focused at production of more proteins and enzymes. So synthetic substances would be enhanced, so that the energy utilization will be focused about the repair. And at that raised temperature, the phagocytes and other defensive cells, they would be more active, more effective, and hence it can inhibit the growth and reproduction of many microorganisms. Whereas it could be again the body microorganisms can be suppressed by increased the phagocytotic activity or other immunological activity where the organisms can be destroyed. At the same time, when the temperature is raised, the rate of division of the organisms also can be lesser, so that it facilitates the body to cure or to have a recovery from the cause of the fever. But there is a possibility of potential damage. Fever is beneficial, that's true. Fever is beneficial, but if it is very excessive and high, much higher than the limited capacity of the body to tolerate, what we call as the threshold limit, then it can result in damage to the tissues, particularly in very young or very elderly or patients who have a pre-existing disease conditions. It can be a damage in the tissues. It also can affect the fluid and electrolyte balance, because the fever, when it is persisting for a long time, that can result in more water loss, and this electrolyte imbalances also can occur due to the altered metabolic activity. Metabolic demands will be changed as such. So central nervous system effects also can occur occasionally when, due to very high fever and very high activity in the nervous system, it can result in seizures, which we call as febrile seizures. So these are the adverse effects of the fever. Otherwise, primarily, fever represents a coordinated response of the body to combat the infection or inflammation. But it can be uncomfortable, but it is usually a sign that the body system is functioning properly to fight off the pathogen. So when you have a fever, that means your body is healthy and fighting with the disease. You are really fighting with the disease as such. So that's why the artificial suppression of the disease, fever, is not really ideal or good. Anyway, I will come to that part later when we go into the therapy part. Now when we say the pyrogens, I refer to that word pyrogens, the chemical substances. The pyrogens are categorized under two categories, endogenous and exogenous pyrogens. Endogenous pyrogens are those which are produced within the body as a result of the injury, and they are, I will come to that list of those pyrogens which are identified. The major pyrogens which are identified, and some of them are related to the viruses, are now coded as IL, that interleukins 1 beta, interleukin 6, tumor necrosis factors alpha, and IL-10. These are now well known, and their relationship with the specific organisms also are known, like viruses of different sorts. Mainly in the patients who have a febrile seizures, IL-1 beta is more commonly increased, and and IL-6 also is more commonly seen in febrile seizures as such. So in the febrile seizure conditions, these are identified as such in majority. So these are well identified the cytokines, but it's not only that much. There are many other cytokines which are now being identified as such, and these cytokines are released by the body, like the macrophages and monocytes, which encounter the pathogenic stimuli, and they reach to the hypothalamus, which give a idea to the hypothalamus about the intensity of the inflammatory activity occurring in the body, and decide about the temperature set point, like whether it has very high or moderate. That all depends upon the type, chemical type of the cytokines, as well as their quantity. Then the other is the exogenous pyrogens. Exogenous pyrogens are which are coming into the body from the exterior, and many of the bacterial toxins or even proteins, many substances, proteins, they can be acting as the pyrogens, and in these conditions body may not have a control over the amount of these pyrogens, and the fever may go or as such. Now the whole purpose of the fever is, as I told you, to protect. Now to how that protection occurs, in a resting condition, in a normal condition, the maximum of amount of the energy is utilized for maintenance of the basal metabolic activity, or rather the other way, you use more energy to digest the food which you have consumed than really the other way, and the energy produced or energy utilized for breaking down the food is again significant. The energy which is really used for maintaining the metabolic rate is quite huge. The energy which is produced or which is spent by your physical activity is much lesser than the energy which is used for maintenance of the metabolic rate and the breakdown of the food. Now, in a patient who is having that inflammation, to protect the body tries to shift this energy utilization for the disease condition by reducing the amount of the energy which could be utilized for the digestion of the food, breaking down of the food. So that's why a patient with the fever would always have a reduced appetite, reduced digestive capacity. The amashayodbhava pathology relation to the amashaya and the jvara is about that fact, which is actually a protective response of the body to have more energy to fight with the disease. That's the one of the important issue, and this is based upon this graph shows the amount of the energy utilized for the metabolic activity in women and men, male and female, in comparison to the total body physical activity as such. The most important is the energy which is utilized for a physical activity is much lesser than the energy utilized for the digestion of the food and production of the energy from the metabolism. And in a case of febrile condition, there is a tendency to preserve this energy, and preserve the energy mainly by reducing this source of the physical digestion. At the same time, if the physical activity is reduced, rest is taken, patient takes rest, that also gives some more energy to fight with the disease. So reduce the food intake and reduce the physical activity as the primary mechanism of treating the febrile condition is having the same issue. Now, hence, fever is a beneficial condition, protocol or response of the body, and it enhances the immunity, increases the mobility and activity of WBCs, stimulates the interferon productions and activation of the T cells, inhibits the growth of microbial agents. These are now well known, and hence, patients having fever is is a sign of fighting with the disease and good for the treatment, and hence artificially suppressing the fever is not the ideal form of the treatment anywhere. It's not only my opinion. There are lots of articles which are coming up in the present set of research activity journals, and those who are interested, they may refer to any of these articles or maybe all of these articles which I have read. They are very valuable, which give a very standard base or solid base to the theory that the use of antipyretics in the treatment of fever is not really an ideal step, should not be the first step. You have to give regulate the diet, and the rest being the primary protocol of the treatment of any febrile condition that has a very strong, solid base as per the contemporary science even. Now, the whole response of the fever, the biological activity in the fever is now categorized or assessed particularly. Now, this response is mainly as per the, in case of viral infections. When the viral infections will occur, initially the body doesn't respond. Then there will be a response in the form of production of more cytokines, and the cytokines will be reduced after a certain period of time, usually by about a week or so. Then the further amount of the reaction would be by the lymphocytes, the cell type would be altered, and the disease severity would be usually reduced. So cytokines, inflammatory cytokines would be lesser and they would reach to the peak at one stage. And hence, accordingly, the fever also would have a typical pattern. The normal body temperature initially, in the first stage, it results in a rise in the temperature which is usually for about the first 2 or 3 days and that's what you call as the effervescence stage, where the temperature tends to rise. Then the next 3 or 4 days, the temperature resides in a persistent condition, which you call as the persistent febrile stage, and then there is a defervescent stage, where they usually by 4th to 7th day, by 7th day, the fever usually subsides, on an average, particularly in viral infections. And this corresponds to the changes in the cytokine activity. The cytokine activity, when it is in the peak, the second stage of persistent febrile stage would occur, and this is the normal response of the fever. And the clinical symptoms also would be like in the initial stages. The first stage, the metabolic activity of controlling this metabolic activity, like gastrointestinal tract symptoms, like the reduced appetite and pain throughout the body, generalized body ache due to the muscular response would be the presenting symptoms. Second stage, the symptoms would be very high fever and there would be the other very toxic symptoms. The third stage would be the stage of recovery, where the temperature tends to go reduced as such. Now, exactly the same are seen or compared to the Vataja, Pittaja, Kaphaja, Jvara. Now, that's one of the important point. Shamo aratihi vivarnatvam vairasyam nayanaplavaha ichhadvesho muhushchapi shita vatatabadishu jrimbha angamardo guruta romaharsho aruchisamaha apraharsha shitancha bhavati utpapsyati jvare. By the time the jvara is produced, the symptoms would be a generalized debility and there could be a impaired taste appreciation or anorexia. There could be discharges from the eyes. Then the patient may have unusual liking or disliking for the cold or warm temperature, and there would be jrimba, yawning, angamardaha, pain throughout the body, guruta, heaviness, romaharsha, there could be erection, pyle, aruchi, impaired taste appreciation, at times tamaha, feeling like depressed activity, apraharsha, where the patient would not appreciate the changes around, and the shitanta, feeling of the cold. This is exactly the clinical symptoms which would occur in the pre-effervescent stage, now in the first stage as such. Then in general, samanyatah jrimba atyartam samiranat pittat nayanyodaha kapat annabhinandanam sarvalinga samavayah sarvadosha prakopaje dvayoh dvayasturupena sansystem dvandajam viduho. In case of Vataja Jvara, the yawning or what we call as the neurological symptoms will be very predominant. In Pittaja Jvara, the burning sensation and the temperature raising would be rapid and more. In the Kaphaja Jvara, impaired appetite is a major symptom which is seen, and in the Tridoshaja it will be, all the symptoms will be seen. Now, in a typical febrile condition, any febrile condition, these differences can be easily made out if you take a characteristic history, and that Vataja, Pittaja, Kaphaja Jvara diagnosis is relatively easier, even at the stage of Pururu. Then once the symptoms would occur, that symptoms would be having a typical pattern, and we will continue in the next session about Vataja, Pittaja, Kaphaja Jvara, and their clinical assessment would be the factor which will continue in the next session. So we will conclude today as the time is up. If there are any questions, I will try to answer, and then okay, no questions. So we will conclude today. We will continue in the next